According to Casey House, 1 in 5 people living with HIV are denied healthcare services because of their status. And that is a stat that the organization is looking to change with the launch of a new campaign aimed at educating medical workers.
I can never forget the time the doctor said, disclosed my HIV status and said, "How many partners have you been sleeping with?" And that was really a shock to me, like a doctor talking like that.
You just heard from Amutha. Amutha has been an advocate in the HIV sector for more than 20 years now and knows all too well what it's like to feel unwelcome in a doctor's office. Amutha shares her story in Casey House's Smash the Stigma campaign with the goal of educating healthcare providers. Casey House has come out with Stigmavir, which is not a real medication, but on the fictional box it says a pill a day keeps the HIV stigma away. Goes on to mention it's for those experiencing things like refusal to touch, patient blaming or shaming, and a lack of empathy. So with more on this initiative, we are joined in studio now by Joanne Simons, CEO of Casey House. Thank you so much for coming in today.
Thank you for having me.
This Smash the Stigma campaign, it's been around for 6 years now. In each year, a different focus. Why the focus? What we heard from Amutha there, the focus about medical professionals, because you would think in a field where healthcare professionals are very educated, that this wouldn't be an issue. How often are we seeing this?
Yeah, unfortunately, on a daily basis, it's the biggest reported issue that our community, our patients face when they're accessing healthcare, which both harms them mentally and emotionally, but also means that they don't access healthcare on a frequent basis, and they can't then have good health outcomes. So it is a real issue that we continue to face, and with this campaign, as you say, we're really trying to bring awareness to healthcare professionals so they can think about their actions, their words, and understand the impact it may be having on people who are living with HIV.
Have you heard any feedback from any medical professionals about this campaign?
I think they're excited, right? I think they're curious, they're interested, because we've done it in a fun musical style, and we want to pull people in so that people can gather in their clinical offices, in the hospitals, talk about what some of their biases may be. So far, it's all been good. We've had a ton of visits to the website and people downloading our toolkit.
Why do you believe this stigma still exists?
Yeah, I think it's complicated, to be quite honest. I think there's still a bit of a hangover from the 80s when we were in the real thick of the pandemic, and that fear continues to today. We don't spend a lot of time in med schools talking about HIV, talking about stigma, and I think now when we think about the population who lives with HIV, it's a very marginalized group. And so they're not only receiving stigma because of their HIV and the shame and blame associated with that, but also in terms of their race, their cultural beliefs, substance use, mental health. All of those things are compounding, which means they're not accessing effective and judgment-free health care.
You mentioned one thing there, that you don't hear about it in medical school. There isn't that specific training. Do you believe there should be? Can something be implemented for those who are coming up through the system where this doesn't become a problem in the future? It is nipped right in the bud.
Absolutely. In fact, we've had a few conversations as we launched the campaign with universities across Canada, and they're very interested in engaging. And our Chief Medical Officer at Casey House, Dr. Ed Kacharski, teaches at U of T, and so brings the patient perspective to every class that he possibly can.
Very good. For those who are not familiar, please share with our viewers what Casey House does on a daily basis.
Yeah, so we're an HIV specialty hospital. We serve people both living with and at risk for HIV. We have a 14-bed inpatient unit, and we have an outpatient clinic to help keep health stabilized, provide hot lunch, medical care, physiotherapy, rec therapy, a variety of different activities to make sure that we're creating a safe space for people to re-engage with healthcare.
You do very important work. Thank you for all of the work that you do. If anyone wants to learn about this campaign, where can they go?
Stigmavir.ca.
Beautiful. Thank you, Joanne.
Thank you very much.